This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's that time again.
Hey,
you believe the summer's over?
Almost.
Jeez, where did it go?
Well, I know where it went for me, right, John?
That's right. You were in Marlton at your facility.
You bet.
It's another edition of Health Watch, as I said, right here on Talk Radio 1210 WPHT. Every Sunday we're here from 8 till 9, and this is the place. If you want to get healthy, you want to get more information, this is what we do for the next hour. Our mission statement, we try to get you healthy and improve your overall quality of life, and that's what we do. 855-839-1210 is our number here in the studio, 855-839-1210. Health Watch features, of course, Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And as I said, we talk about the who, what, when, where, why, and how of Innovative Medical Associates, and we'll do that shortly. Again, 855-839-1210 is our number here in the studio. And we always start with, well, whatever it is. What do you do, Dr. Molly?
I know, John. Well, okay, let's start for the people who are just recently listening to us. And for the rest of our listeners, I'm told that they still enjoy the first part of the show, which is great.
Yes.
Anyway, what Innovative Medical is a group of like-minded practitioners who all work out of my facility, primary care facility, in Marlton, New Jersey. And what we do there is primary care, but our focus really is on the delivery system. We believe that there are a lot of times in primary care that patients are giving a multitude of medications, and we find that sometimes the medications are worse than the condition itself. So our thought process was, let's see if we can eliminate some of the medications, not all. We don't tell our patients, get off your meds. If you have hypertension, we're going to want you to stay on your blood pressure meds. But what we want to do is augment that with maybe natural substances, God's ingredients, I like to call it. And by doing that, we're able to deliver those by hydration.
You know, interesting story. You were telling me before the show.
Yeah.
You went to get an eye exam.
Oh, yeah. I finally took care of myself.
Yeah. And, it's interesting. What did the doctor say?
Doctor said to me, how is this possible, Dr. Molly? Okay. He's a very nice guy, but he's a traditionalist. And he said, how is this possible? He said, your 2 cataracts, and I have 2 small ones that I've had for quite a while. He said, they have not gotten any larger. He said, I expected that after you missed the last appointment because I was busy and I had to push it out another 3 months because he was busy. So I said, I said, what are you telling me? He goes, and your actual prescription hasn't changed really at all, maybe a point or so. He said, how is that possible? I said, well, if you really must want to know, Doc, I said, I have a protocol for this. And he said, apparently you do. I said, I do. I said, it includes a glutathione as well as coenzyme Q10. And I said, the idea is I want to make sure that I get enough. And I also use, believe it or not, I use a particular brand of Ivites for it. So he was very impressed.
Goes to show.
Oh, well, listen,
I always ask you, does it work?
Does it work? And I will tell you that I'm one of these people that believes in using it on themselves. You know that, John. You know in fact, my entire staff, you'll notice what we try to do is somewhere between Wednesday and Friday, depending on how busy we are, everyone who is a staffer of ours gets on a drip.
Yes. So the question is, yes, it does work. But what conditions have you found over the years that it works best for?
Well, obviously, we cut our teeth on hyperlipidemia and cardiac issues. And for years, I mean, we have people who are still in my chair right now who started with me maybe 15, 20 years ago and now just come in for the maintenance. So I would say cardiac issues, diabetes, we try to help with the neuropathy a lot, and indeed we do. But overall, I would say most chronic conditions we have treated somewhere along these 27 years.
Yes, and we're going to talk about that later
Sure.
on in the show.
Sure.
But another question, this is the two questions you get: does it work, and how many treatments do I have to get till I feel better?
Well, that depends on when you come into me during this continuum of your problem. If you come in early enough, I would say you're going to get relief after 5 treatments or so, which might be 5 weeks. But if you come in, let's say you have cancer and you come in late, you're at stage 4, well, it may take a good 30 treatments, which might be 15 weeks if we play it right. So again, though, John, it's pretty rapid. You can start to feel more functionally better. And look, John, we're not curing anything, but boy, are we going to improve your quality of life.
And we're going to talk later on about some of the patients.
Sure.
But already a couple of people have come in for 2 or 3 treatments, and they said, I
you're
feel,
there. That's right.
That's right.
Yeah, this is great. You could have a show there one day.
Yeah, I should.
Because that those people in there have a lot of opinions, man, on what's going on in the world.
And because they find out that I'm the one that does the show.
Well, you open up your mouth, we hear that radio voice. So yes.
And they tell me, well, this is it, and they're telling me different stories.
Sure.
But they are telling me that it's working.
Yes, and if people give it the time and give it the judiciousness in terms of other things that we tell you to do, whether that's to continue your medication, will help you reduce your medication, those kinds of issues, then we can help you. And maybe if you go home and we have a little lifestyle change, look, this isn't holy water. You can't walk in and I sprinkle it on you and, there it goes. No, it doesn't work like that. It works in tandem with some other things, but I will tell you, it works.
You're saying that you can help people get off their medications.
Yes, or reduce them.
Or
sure.
reduce them. Now, you don't want them to just stop.
No.
You
And
want to
that's
give them advice.
Well, let me tell you something. I've had cases in the last month or so where people just stopped and came to me after. They stopped the medication. They claim they heard our show. They stopped their meds. I said, I don't think I've ever said that on this show. Don't do this without my docs helping you stop those meds, right? And they laugh. Well, look, I'm still here. Well, yeah, okay, but I don't really want you to come into the clinic like that.
Yes. Okay. So you want them to have some advice
before
they
stop. Sure, and there is. I mean, you need to have a good medical professional, healthcare provider help you reduce the meds that are necessary for your condition.
You have had a lot of cases where people have gotten off their meds.
Absolutely.
Almost completely.
Yes, or maybe reduced and also change the category of the meds. Sometimes with the blood pressure meds, sometimes people are on them too long, John, and we have to change that up a little bit. So it really depends on what the patient is coming to us. And the other thing I want to caution people about, this is something you and I talk about, just don't go into the health food store and say, send me to the blood pressure division or send me over to the cholesterol division. Don't do it. Let's give you some advice along those lines.
Yes. It's interesting because we were talking about this. I mean, you have so many stories.
Yes, we have a lot of stories, and there's a lot of stories in the naked city. So we can really talk a lot about this.
Yes. We are coming up on our first break of the morning. The show is Health Watch. Every Sunday we're here, the live version, 8 till 9 here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, the number here in the studio, 855-839-1210. And we always tell you, call early because we can make sure we can get to your call. And just about every week we get a call at 2 minutes to 9. So call early, and we would be happy to take your call. 855-839-1210. We are coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, and their number, 856-489-0505. Again, that's 856-489-0505. When you call, this is simple. All you have to do is make an appointment to meet with Dr. Molly for the initial consultation. It is complimentary, doesn't cost you anything, and you will learn a lot. Believe me, you will learn a lot as far as how they can potentially help you with your problem or your situation. And again, the number 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. You may want to check that out as well. This is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Our number here in the studio right now, if you want to talk to Dr. Molly or you have a medical challenge you'd like to run by her, 855-839-1210, 855-839-1210. You know, Dr. Molly, I remember when we first started doing radio shows with your late original director.
Oh, he was the best.
He talked about the mitochondria of the cell, the powerhouse of the cell.
The powerhouse of the cell.
I still have that in my mind.
You still have it in your mind, and it's true. You know, when we talk about the powerhouse of the cell, I think I liken it to our energy grid. Right?
Yes.
Our energy grid. And if there is a situation where the power has been decreased in our energy grid, what happens? We have like little tiny brownouts, not necessarily blackouts. However, you could also have that if the power is cut. Right?
Yes.
So that's a twofold understanding about mitochondria. Mitochondria can be involved in disease states, or it can be dysfunction, and it really impedes the body functionally, right? So it can be really dysfunctioning because you have a genetic propensity for this, which means you've got a gene that's sort of dysregulated. That's also causing the structure not to be able to use the oxygen, the sugars, the ketones to make the energy that they need to function. So you could actually have a genetic disorder. But a lot of the cases that I see that come in, what they tend to have is that the mitochondria just doesn't work effectively because of what, John? Stress, by environment, our diet, and we can go on and on. Now, when mitochondria is dysfunctional, what happens is you can have symptoms that run the gamut. So you really don't know whether the patient is really has a disease state mitochondria or a dysfunctional state, right? In other words, you come in and you say you have pain, you have migraines, you have all kinds of challenges with your neurodegenerative diseases, right?
Yes.
So maybe that is twofold. Maybe the environment has helped cause this. Maybe there's a genetic component. But you know what? I've seen more and more neurodegenerative diseases where there's no genetic link in the family. Isn't that interesting?
Yes, and you've talked about that
right,
many
we've
times.
talked about that. Also, with mitochondria dysfunction, we could have muscle weaknesses, muscle tone, muscle spasms, uncoordinated movement. You might be able to see that, of course, again, in people who have MS, right? And is there a genetic link? Well, you look at my medical director. We went back all the way back. There was no genetic link for MS. Interestingly enough, though, her brother has Parkinson's. So isn't that interesting? Although they can't actually find the genetics that are causing either one of this in their particular challenge. So something caused it. Yes. Environmental stress. Let's go back. So you can have heart problems, which, causes arrhythmia and cardiomyopathy. We can have thyroid problems, diabetes, digestive problems, hearing loss, liver failure, and kidney dysfunction. All of these things are really a result of mitochondria dysfunction.
There is a difference, though.
That's right.
Between dysfunction
and disease. That's what I'm saying.
Two different things, right?
Two different things. What we have to do is there are ways to prove that you have a mitochondria disease, and that's done through laboratory tests. It may be done through radiology. There are many tests that can go on to really make sure this is not a true mitochondria disease. A genetic test can be done. DNA, which is very important. So again, you when you come in for an assessment, you want to see is this more like dysfunction that really results in deficiencies of maybe some portion of the mitochondria, like not enough CoQ10 enzyme, things like this. So again, it really depends. But I'm going to tell you, if you have a dysfunction in certain areas that we spoke about earlier, that I talked about, we have a protocol for it.
I knew that.
Okay, but here's the nuance, and this is the thing I want to get across to people. Sure, what can work and help the mitochondria in general? Well, in general, we want to do things like antioxidants, right? Because they need this to what? To hold down inflammation. But if they're neurodegenerative, might I look at some other things to put in a protocol for someone that has mitochondria dysfunction related to neurogenesis rather than someone who has it for cardiac, right? Two different types of things. There may be some overlap in that, John, but what happens is that specifically, depending on where we see the patient's challenge, we're then going to put the protocol together.
Do you have any situations where you've used this currently or
every
in the
day,
past?
every day. Because when we look at many times we'll run nutritional deficiencies and find out that the patient is presenting with a problem, and in the end, it's a deficiency maybe in selenium, a deficiency in B vitamins, or in one of the amino acids. So then what do we have to do? We have to augment that through the hydration and deliver that particular nutrient to the body through the hydration. And it's a direct hit this way, right? And as a result, we're able to really mix it up a little bit depending on what problem you present with.
And you would treat this the same as you would treat a lot of other
Well,
things?
I would say to you that when you come in and let's say you have a cancer diagnosis, right? Well, right there and then we know your mitochondria is screwed up,
yes,
right?
Yes.
Okay, because what's happening is you obviously are either in overdrive or underdrive in certain things, and more likely it's the combination, John. Everything has to be just right for the power plant to work correctly. That's the same thing with our grid, right? Something goes wrong somewhere along the line, you got a problem.
And so you're getting the power grid to work properly
exactly.
through the hydration.
Through the hydration, the delivery of the remedy. That's the question. What do we do? And what are we trying to do? And what are we doing to make the powerhouse work for a particular portion of the body, whether it's the brain, whether it's the heart, whether it's the nerve endings? So it's very complex, but everything goes back to mitochondria health.
And
this
it goes back to hydration.
This is it.
Yes.
Right. The hydration is extremely important. Mitochondria health is very, very important in anti-aging. The newest rage. Everything is about anti-aging, right? My eyes, for example,
yes,
right?
Yes.
Okay. So, do you think I had a little mitochondria dysregulation that I had the cataract? Well, somebody's going to say, well, that's just a function of old age. Well, no. Yes, it is. But why? We're exposed to what, John? Environmental toxins. And you and I are exposed to tremendous stress, right?
Yes.
How about lack of sleep? Do you think you and I have had days where we've had lack of sleep? Okay,
that's
including
true.
this one?
Yes.
Absolutely.
Right.
So what I'm saying is these are the things that really can really create havoc with our bodies. And as a result, what we have to look at is to look at what happens to our powerhouse of the cell and why is the crucial role of energy production linked to overall health. Well, we know why, because we know that dysfunction is linked to many, many diseases. That's the disease state, aging, and decreased energy level. And we know that lifestyle also is a key to this. So let's be honest. If you and I go out and we drink alcohol 3 or 4 times a day, do you think we're helping our mitochondria?
No, not at all.
No. Now, I'm not the food police, right? I've said this repeatedly. But we have to look at also looking at our lifestyle and really make some adjustments. For example, I am not against grapeseed extract, so that means I'm not against red wine either, right?
Right.
So we have to look at these things and say, okay, how do we put these together? Another thing, John, I talk over and over again about peptides. There are certain peptides that work in certain areas, and they're crucial for the mitochondria.
And we will pick that up after the break. We are at the halfway point of the show. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. This is our live version of the show. 855-839-1210 is our number here in the studio. We've got some open lines if you want to jump in here with a question or medical challenge for Dr. Molly, 855-839-1210. That's our number here in the studio. It is Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly, and we will both return right after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and the number, 856-489-0505. Again, 856-489-0505. We give that number out because when you call there, you can directly talk to the operators, and you can make an appointment with Dr. Molly for the initial consultation, which is complimentary. And then you can really find out if Dr. Molly can help you, and the chances are that she can. 856-489-0505. That's the number. And the website, innovativemedicalassociates.com. Check it out. A lot of good stuff on there as well. Innovativemedicalassociates.com. It is Health Watch every Sunday, 8 till 9 here, the live version on Talk Radio 1210 WPHT. The number here in the studio, we got some open lines, 855-839-1210. That's our number here in the studio, 855-839-1210. Interesting, Dr. Molly, that you do not treat children.
No.
But you were treating the mother.
I was treating the mother.
And then somehow or another you got to the child. He's very young, but, I mean, this goes to show you this story about mitochondria.
Right. This is a very interesting thing. Okay, they're from out of town, and they came to the clinic. The mom came to the clinic because she had some conditions. In particular, she had some neuropathy and that kind of thing. But what was happening is while she was talking to me, I saw that her child had very bad digestive problems, was throwing up. And I said, have you had this young man checked out? Yes. They said he has a genetic disease. I said, what kind? Well, we don't know. I said, well, who's treating him? Well, actually, nobody right now. I just have to keep him on the feeding tube. I said, you do? He's about 3 years old at this point. So I said, well, I said, this sounds to me like he may have a genetic mutation that is related to the mitochondria, and don't you think you ought to know exactly what it is? Whatever. I said, can I order the records? She said, sure, I'll sign for them. And while they were here for 2 weeks. While they're here, I had the docs and my nurses and myself comb through the records, and boy, did we see some challenges. So I realized that there were several mitochondria specialists at Children's Hospital who really work on the digestive disorders, believe it or not. And I thought, wow, how do I get this patient's kid there? Because I think her worrying about her son, and this is their only child, can you imagine? Worrying about their son is certainly contributing to what's happening for mom. So, I looked at this, and I called a colleague of mine who also was a patient of ours, and she happens to be a pediatrician. And it just so happened that in her practice, her medical partner knew the scientist who was working on mitochondria diseases at CHOP. So I scooped up the records, put them in certain order. Her colleague took a look at this and said, Dr. Molly's all right. Let's get it over there, right? If we can, and get him in. As far as I know, as of right now, and I did speak to her about a month and a half ago, the kid is being treated by the team at CHOP. They had to do some more genetic testing. So this goes back to what I was saying before the break. If you have mitochondria disease that is due to the inherent mutation, that's a different situation. You may not be able to prevent it, but what do you think, if you're an adult with this, we can do for you?
Yeah,
we can
yes.
improve your quality of life if you have a mutation in the mitochondria affecting you in some area. By what? Looking at the natural substances, reviewing the chart, helping you look at possibly getting more sleep, helping you manage your weight, reducing your stress levels, and managing the alcohol. So we may be able to help you through the hydration and some advice to give you a better quality of life while you have these conditions.
You know, it's interesting because this would have not been discovered had she not come to you and said something.
That's right.
And again, how many times have you had this happen?
Well, I sort of tried to worry about what's going on in the state of medicine right now, that someone else didn't pick this up, like her pediatrician, and just decided to take the easy way out and put a feeding tube in this kid and say, that's it. But what I realized is, look, this goes back to the old story that what is happening all around you, right? If someone in your house, when you're under stress, you also have a challenge. The mom and dad had a challenge, okay? So this is just something along those lines.
We are going to the phones. We have Robert on the line. Robert, good morning. You're on Health Watch with Dr. Molly.
Hi, Robert.
Hi, good morning. Thank you both, first of all, for this outstanding program, given the nuggets of information. I have 3 questions, but I think one has been answered already, but I'll just mention it anyhow.
Sure.
What do you mean by cellular or mitochondrial hydration? Is it involving more water containing various nutrients? And how do you know if those cells or mitochondria are deficient? I think you answered part of that. And lastly, do you take Medicare?
Don't I wish we could take Medicare? However, I still would love to talk to you. But nonetheless, how do we? As I said before and earlier in the program, there are some testing that we can do. We'd also want to do a good complete history with your family. Why are you having these problems? Okay, that kind of situation. But yes, there are many things you can do. And when I use the term hydration, I'm using that as the vehicle by which I can get the vitamins and the nutrients into the body to the affected mitochondria, which might be by system, you say. Doesn't mean you're totally dehydrated. But I will tell you this, sir, you hit on something very interesting. Lots of my patients right now are coming in grossly dehydrated. I can't just, and so God bless you, you're on the right track with this. And remember, as our mitochondria goes, so does our life, you know? It's a gift from God, this mitochondria, and we better respect the fact that we have to keep our engines running. God bless you, sir. They were great questions. God bless you.
Thanks for the call,
Thank
Robert.
you.
We appreciate it. We appreciate it, Robert. Thank you.
That was a good point he made. How are we looking? We're delivering certain B vitamins, B1, B2, B3. B3 is a precursor to NADH, but coenzyme Q10 is very important. You know what I say? I take a lot of CoQ10. As you know, I said, even when I'm gone, maybe the CoQ10 will be working. The selenium, of course, vitamin D, alpha lipoic acid, particularly for people who have the diabetes, this kind of thing, L-carnitine. And so, and again, the peptides, certain peptides to effectuate change in certain systems, because we look at these deficiencies for the syndromes or the dysregulation. But again, you want to make sure that we have all the information we need to really help you utilize the mitochondria in the best way possible for a patient.
Okay, 855-839-1210. That's our number here in the studio, 855-839-1210. is there anything more that you can say about this mitochondria
Well,
situation?
I can tell you that you've got to really, really keep your mitochondria in good shape, and the way to do that is to make sure that you limit your environmental exposures. You make sure you get tested for certain conditions, and you just keep your body in good shape. And remember, there's a ton of information right now on PubMed talking about mitochondria dysfunction, chronic disease, and the treatment with natural substances. What's happening now is it's not just in the European PubMed, but in the American journals as well now, that we realize that, of course, the body needs certain nutritional vitamins, minerals, etc., and peptides and amino acids in order to function properly, system to system to system, and keep the powerhouse of the mitochondria in those systems working.
It is certainly a difficult problem to have. I would think,
it's difficult.
And it's difficult to treat, too, as well.
Exactly.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge you want to run by Dr. Molly. 855-839-1210. That's our number here, 855-839-1210. Our program is Health Watch, the live version every Sunday, 8 till 9 here, Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are both coming back with more of today's Health Watch after these words. We are back here on Health Watch. Again, operators standing by, and they will be there well after we leave you at 9 o'clock this morning. They're working all day, okay? They're not going to the beach. 856-489-0505. That's the number, 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. Don't forget, if you miss any of today's show or you just want to hear it again, it's our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. But we are live here now on Health Watch. 855-839-1210 is our number here in the studio. This is the point of the show where we kind of give an update on patients, Dr. Molly. And
okay.
We're talking about one of your cancer patients?
Oh, yeah, this is a great case. So she's one of my patients from out of town, and she was here for a 2-week stay. What happens is she's taking chemotherapy in her home state, and it's given once every 3 weeks or some variation of that, and it may be a 10-day course. But she was having a little bit of problem. She comes out to see me for me to tune her up in the interim period while she's getting the chemo so she can get through it. And I have to tell you that this time, of course, the chemo is going up and up in dosing. So she had a rough time at the last chemo. And what we did was we tried to really tune her up without, of course, interfering with the drugs that the chemotherapeutic was giving her. And interestingly enough, I got the reports from the oncology department of where she's going, the system she's going to, and her tumor has shrunk considerably. This is a good news. She had ovarian cancer, which is pretty tough, as you know, John. So, and she really, really wanted to see her son's wedding. And her son's wedding was last week. In fact, she took her son and his new bride with her up to see me because she felt like my staff was wonderful, helped her get through the wedding, which I agreed with, and we really did a good job. That's a sweet story.
Yeah, that really is a good story.
It really was a sweet story. And she's doing very well. But here's the dilemma. When you get the chemo, many times there are certain things that are affected in your blood count. Like it could be your red blood cells. You get anemic. In her case, her anemia has been very well controlled, but there was a challenge with the platelets. Now that has to do with bleeding. Of course, the platelets, when they aggregate, they are clotting factors. So many times the clotting factors are involved in some of the chemotherapeutics. They get dysregulated. So we've been working with that. There are some natural substances that can help that, including piperine and some other things that might help in that regard that I won't go into here. But we feel like we got her platelets up. They have a cutoff of, I think, 55. And as when she left, she was down from 40-something to 54, I think. So we're getting there. I think she'll be fine when she gets back. And, of course, I'll know tomorrow.
So the tumors have shrunk.
Big time.
Yes.
Big time. And I think that we've had something to do with it. If only we help you get through conventional treatment. I'm not saying that, don't give up your conventional treatment. Or I'm not saying if your philosophy is not to do conventional treatment that we won't treat you. We will.
Yes.
We meet the patient where they are. But again, you've heard me say time and time again, if you have cancer and you have an opportunity to get it out, it's a beast. Get it out. Get it out.
Exactly. But in this case, I mean,
the tumors were so large that they couldn't do the surgery. That's why she's doing the chemo. They're trying to reduce it, and I think we've helped in that regard.
So eventually,
I'm
will
hoping
have
that she can have the surgery.
Okay.
Yes.
Talking about another couple of patients here with POTS, and we spent a couple of shows on this a few weeks ago.
So many initials now, right? but POTS is a really, really difficult case. But an interesting point about POTS is that you really have a lot of cardiac issues, like you have an arrhythmia, you have hypo and hypertension, so your blood pressure goes up and down and this kind of thing. So it is a very difficult kind of syndrome to treat. Now, I talked about the body K a few weeks ago.
Yes.
One of the reasons why I'm using the body K is on these particular two patients, because I'm trying to look at their autonomic, if you remember me speaking about that a few weeks ago, the autonomic system, because why? That regulates things like blood pressure, respiration, these kinds of issues, water content. So I am using the body K along with the hydration to really measure what I'm doing and am I seeing some improvement in the POTS patients by looking at their autonomic responses in the body K. And interestingly enough, I'm seeing that. Now, I also then send my patient to a cardiologist, trust me. And there are traditional tests that they can do. It's called a tilt table test that they do for POTS patients to actually diagnose the POTS. But the POTS patients need heavy duty hydration. They usually are always dry, John.
Can we talk about Julie?
Julie's a tough case. She's a tough case. She left me for quite a while and she came back, and I'm really trying to help her. She has many system involvement, but the poor girl has gone to so many physicians. She actually has to have a notebook to keep track of all the drugs that she's on. This is no joke.
Jeez.
And I worry about her constantly because of this, because, you can be sure that a lot of these drugs are also contributing to how badly she's feeling. And the problem is, how do you get off of all these? You got to go back and you have to start to cut down on the drugs and bring in some of the natural products that may help her. But again, I think this is a complex case, and I don't see it. I don't see it resolving in a quick time period, not a quick time period.
So how long would you think?
I'm going to say she's going to be with us probably for an additional 30 weeks. That's what I think. And in between this, like I said, I'm sending her out to a cardiologist who specializes in POTS, because I think the hydration is helping her a great deal. But in addition to this, she has Lyme disease. So this poor girl she has seen every physician known to man, rheumatology, infectious disease, you name it, she's seen an endocrine. This and the Lyme, of course, disease expert. But I got to tell you, I really think a lot of her problem, and she's not unusual. It's unusual how many medications she's on, but I can tell you that people come into me not only with bagfuls of nutraceuticals, but they come into me with bagfuls of pharmaceuticals. And therein lies a big rub.
I was going to say, that's probably half a problem.
To the problem.
With being on so many medications.
And I've seen this time and time again with a lot of conditions that are autoimmune in nature. People come in with a ton of medication, and the medications all have side effects. And then the medications can have interactions with each other and also with the nutraceuticals, which is why I tell people, look, don't just go out and start picking out these nutraceuticals based on something that a friend of yours told you to do if you have a certain type of syndrome, because you've got to look at the medications you're on as well,
right,
and make sure there's no contraindications there. And these kinds of conditions, like for POTS and fibromyalgia and chronic fatigue and all the viral stuff, post-Lyme is another one. You've really got to look at all of this and see where a patient is and meet them there and say, okay, this is how we can help you. Let's work with your other doc. You've got to go back and talk about reducing, let's say, the Lyrica or some variation of that.
Just one more. The patient who is an attorney, and
right.
her mother brought her in.
She just started with me.
She's feeling pretty good right away.
Well, this is only her second treatment. Actually, I think she's feeling good enough to drag her dad in, who has cardiac issues. But she's a very interesting case because she's in a high-stress job, and I believe that is absolutely contributing to her overwhelming sense of fatigue, the pain level that she has, etc. Now, I can't really say yet what we think the condition is. Most of the physicians that she went to, pretty much, she said she went through 7-8 physicians. They they think it's a fibromyalgia case. I think it's a little more in depth than just fibromyalgia. I think it's one of these cases where there's pain head to toe, and I think we really have to look at some other things.
She did say she was in a lot of pain.
Absolutely,
she told me that.
Absolutely, and I believe her. It's not just in her head. Believe me. Look, you don't go through law school and it's in your head. You know what I mean?
Yes.
Come on, you got to laugh at that diagnosis. Yeah, it's in her head, all right. It's in her pain central.
It's a common diagnosis. It's in your head.
Yeah, I know.
How many times have you heard that?
Myself, I was told it's in my head too. So you know what I mean. Bottom line, folks, don't just go for that. Let's go in depth and see what we can do.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505. That's the number, and they will be there well after we leave you at 9 o'clock this morning. 856-489-0505. That's the number. Don't forget, if you missed any of today's show, we're on again this afternoon. Our Health Watch replay, 4 until 5, right here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, and Daniel. And then, of course, there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.